So most women have a positive experience of childbirth, but for some women, birth can be very traumatic, and that can be emotional or physical trauma or both. And in some cases, extreme cases, it can be post-traumatic stress disorder. According to some research, 20,000 women experience birth trauma, but there still needs to be a lot of research in this area so that we can get a better idea of how many women are affected. We're still learning more about what causes birth trauma, but in our experience from women we've spoken to, a long and difficult labour can cause birth trauma, or unexpected outcomes. So, for example, if a woman has an unexpected emergency caesarean section or an unexpected instrumental delivery, especially when she didn't feel in control of those decisions, then that can be birth trauma. We also know that physical birth trauma can be, for example, perineal tears or anal sphincter injury, which can also constitute physical birth trauma. Symptoms of birth trauma can range from fear or feeling of helplessness or anxiety, sometimes non-specific anxiety and depression. And sometimes also women can experience flashbacks which can be triggered by other events. We do have partners who have really traumatic experiences of what they've witnessed of their partner going through in labour or birth trauma. So we are encouraging partners to come forward and get help as well. It really depends on the type of birth trauma. If it's physical birth trauma, such as an anal sphincter injury or a perineal tear, then we would deal with that as obstetricians and gynaecologists. If it's emotional birth trauma or PTSD, then we would usually involve a psychologist or psychiatrist, and that can be treated by CBT or other interventions to support the woman through that. We encourage women to talk about it, whether that's to a family member or a partner or a friend in the first instance. And then it really depends on the woman and her experience. For some women, it helps to be seen. Lots of hospitals now have birth afterthoughts clinics, and they can go and be seen in one of those clinics to go through exactly what happened and get relevant support. For some women, support groups help, so peer support, the Birth Trauma Association itself can be very helpful. So we do signpost women to whatever support would be relevant to her. I think there's a lot that healthcare professionals can do to prevent birth trauma. Firstly, we as doctors and midwives have a lot of work to do in being better at imparting information antenatally so that women are prepared for childbirth, so they understand what might happen and they can feel fully informed and fully involved in all those decisions. And we're working closely at the Royal College of Obstetricians and Gynaecologists with other organisations, including the Birth Trauma Association, to try and communicate with women and have honest dialogue with women so that they can feel more in control of what's happening to them during childbirth.